Okay?
All right. Go for it.
All right. Well, I am Donna. I really wish Cindy was here because with that disease, diagnosis, and I do have a severe IBS. And I've had it, I'd have to say I'm 69 years old, just turned 69, and I think I've had it since I was about probably 13, 14 years old, and not even knowing it.
My word.
Not even knowing it. I've worked 55 years still in the medical field, and I've got the best doctors taking care of me. And how long, Paul, have you been here?
Since 2002.
So a week before this building right here, and like Paul says, I live right across the street, I had a doctor's appointment. And at that doctor's appointment, of course, we're talking about my most favorite problem, my IBS. And my doctor said, have you ever heard of BioTouch? And I said, no. And she said, I recommend it highly. So I went home. I was trying to figure out what was going on over here. And I walked over, and the first thing that I heard was BioTouch. And I went, is this a calling? Is this something that, my doctor who's known me for 30-some years all of a sudden tells me to go across the street, and she didn't know, but to look up BioTouch. And I said, Carol, it's right across the street. And she said, don't miss a session. I started out with one, and even Paul started me off with another person, and Paul recommended that I come as often as I wanted to. So I had 1 session, 2 sessions, 3 sessions, and the more and more that I got touched, the more and more I said, whoa, this feels good. But what does it feel good about? And then I wanted to see what my major, after they took the information on my paper, what's wrong with me and so on. And I said, well, you could go from head to toe and I could tell you everything was wrong with me. But the most important thing is that I was reaching out for what my doctor had told me. Go to BioTouch for your stomach. Go to see if something can help you with that. So I started. Of course, they worked on my stomach. They worked on my stomach. And I got I'll never forget it, the very first, say 2 weeks of the sessions that I had, it was like I couldn't even walk out of here. I didn't know if somebody put a plug in me and said that you're going to have the sensation that something is wrong within your body, and you were shaking, and I wasn't feeling good, and I wasn't feeling good. And then I kept on coming back. And I kept on coming back. What it was I felt like it was everything coming out of me, and what they were doing is that they were helping me. I don't want to call it healing, I want to call it helping me, because like I said, I'm in the medical field. But things started changing. And then before you know it, I was able to turn over on my stomach and say, now work on my back. Because I wasn't having that feeling, I wasn't that problem again. I'm being honest, I've been roto-rooter from head to toe regarding my IBS. And yes, it's still there. I still live with it. I still cry about it. But this is my sanity. This is the place where I come, and Paul can tell you, if a practitioner doesn't show up or they're late or whatever, I might be mean, I might be strong and firm about it. It's because I'm needing it. I need it. I need this. It didn't really understand how much importance, this meant to me, to be able to lay on that table and you press on my stomach. You might press a little bit harder or whatever, and I say, be careful, I'm having a bad day. But when I walk out of here, something does happen. And it may last a couple of days, it may last a week or whatever, and my problem is always going to be there. But this place has helped me. BioTouch has helped me. I've been through a lot of practitioners, a lot of them from the day one, and some of them have even said, "Oh, let Donna we'll work on Donna. She'll tell you exactly if you're doing right or wrong or whatever, you know.
You're good for the interns.
Yes, yes. And I love the interns. I loved them. I love being with the interns. But the importance, what I'm trying to say is that this makes a difference as far as the BioTouch. It has done a tremendous amount of good for me. And I will continue. And like I said, when you're not here or you're late or whatever, I get all tensed up, you know, because that's how important it is for me to have it. I do come twice a week, and I'm spoiled. I've got the best practitioners that I've been worked on. And sometimes I'll even call Paul and say, Paul, can you work on me? Because I can remember a long time ago when he does, and his touch is completely different. And her touch is completely different. And this one's touch is completely different. And that one's touch is terrible, you know, and so on and so on. But I still get something out of it, and it has helped me. It hasn't saved my life. It hasn't changed my IBS. And yes, I'm probably going to think of what maybe your friend has done in her life as far as quit, you know, work because she can't any longer and so on. I'm not to that, and thank God. And I think I owe this to BioTouch also. Because all the other things that are happening to me, because of my age, BioTouch is even working on that. And they're helping me with that. No, don't do the stomach. And I haven't had my stomach done in a long time. So that almost tells you something in a sense. But they're working on the different areas. And it's helped me. One thing about IBS, and I don't know if I'm in the right direction of talking about it, but one thing about the IBS is that it affects everything. It just doesn't affect the area of the IBS and what kind you have, if it's a, and here I'm talking clinical, medical, and so on, of the knowledge that I have, not only for medical, but for my own body, what I know my own body. It's not just the being the constipation or the diarrhea situation. Some people will have both, some people will have only one, and so on. You know, I have the worst, the extreme. Never know when it's going to happen. Mentally, what do I have to do in order to live with that and to work through that and so on? Go to work, make sure you know where your restrooms are. Go to work and you have your stress all day long. Do what you have to do. Again, I'm going to repeat myself. This is the place that I look for. This is the healing that I look for. I mean, to the point where it is going to be for the rest of my life. And when I do retire, no, I'll never become one of you guys as far as practitioners or whatever, because that's not me. I'm enough of a practitioner over where I work. But this place means everything to me, and it has helped me tremendously. The IBS, what happens in a human, what it can do, how it can affect your life mentally, physically. You have to work that together with your practitioners. You have to work together by listening. You have to get together and talk to people about it. And let the practitioners know, to me, what I do, let them know how important they are, because they have helped me through this all.
How, are you on meds? Any meds at all?
I was on every medication from, I would say for the past, say 10, 15 years, to the point where, you know, over the counter, you know, through prescriptions. Like I said, I've been rotor from head to toe and so on. I'm not on one medication right now, and I was. Do I owe it to this? No, I probably don't. It's a combination. Mm-hmm. It is a combination. It's a combination of what my body needs, you know, and the stress. It's the stress level. It's the stuff that I need to take. Now, do I take something with stress? Yes. And that's the only medication that I'm on. Does it help my IBS? Yes. But what helps stress and what helps IBS? To lay in that room and relax for 20 minutes, 25 minutes, and let somebody heal you, touch you, feel you. Feel their warmth of their fingers, to the point where they can say, ooh, you're awfully hot right there. And yeah, I've got a backache, but where's that backache from? It's from this. Where is this back hurt? Because it makes my back ache. You know, so it is a combination. So just because I'm on my stomach means you're working on my back, you're still working for my stomach. So no, the answer to that is absolutely not. I'm not on any. I won't probably go on any. And I'll tell you another good thing, talking about the medical situation and so on. At your age, you know, as you get older and so on, they say after 40 years old you need to get a colonoscopy and so on, and every 2-3 years or whatever your physician says and so on. No more. I don't need any more. No more. Not just because I'm old or whatever, and if they, you know, if they feel anything or if they find anything, then, you know, what are they going to do? But why do I need one? I'm not having any problems. You know, my problems is the stress. My IBS is my stress and what I have to live with and so on. So no medication. And I know people that have had severe IBS where they have to be on medication, including myself. But no longer. No longer.
So everybody holds so-called IBS is just a term, but the symptoms can be as varied as the people that have it.
Oh, absolutely. It could be in any form. I mean, any form. And just like wishing that Cindy was here, Cindy. Yeah, wishing that she was here and so on. That's not comparing. I'm not trying to compare. But you know, if you know how you do like a marriage counseling and you go to that, poor divorced people sit and talk to people and so on. I wish there was an IBS group that we can talk about, you know, the differences of what we have to go through and all that. And there are, I'm sure, and you can go on chat lines and so on. Sometimes I don't choose. I listen to people and then maybe I could carry on a conversation with them, but I mean, it could be all kinds of forms. It's to individual, it's whatever they have. And then of course the whole body of what your body needs. I'm very sensitive to medication also. If the doctor tells me to take a pill like this, and if I think that I can cut it, I'll cut it first. You know, take a half a pill before I'll take the full pill because I'm so sensitive to medication. And that's probably why I want to be medicine free, because I am sensitive. Again, repeating, this is my saving grace for me.
And so because this is also about Crohn's disease, how are the two related at all? Do they misdiagnose one with the other? Or?
Possibly not. No, with the Crohn's disease, you know, there might be other symptoms that they have, pain areas, eating habits, and so on, It's the individual, what they, you know, finding a good GI doctor is another good thing, but I will say this, again, like I'm in the medical field, and I'm just speaking from my experience and so on. You look at a GI doctor, they're all the same. So you might, it's just like saying that doctor has a better bedside manner than the other doctor. You know, or you go to the doctor and say, I don't like him because he doesn't converse with me or anything, so I don't feel good about him. So you try to go to another doctor, you know. Well, I have a doctor that I feel that I've been going to him for 20 years. And he's been helping me. Checked on Crohn's, he checked on this, he checked on that. Simply IBS, period. It's your IBS, Donna, it's your IBS. And I'll say it, Dr. Baez, IBS, Donna, IBS. Again, I've been to the clinics where they do procedures for Crohn's, for everything, like like the camera that they put in, and they check for everything. You swallow this camera and they check. And the doctor at the university at Banner, he's the only one in the state of Arizona that does this procedure. I came clear. The guy woke me up like this and said, take a couple of indigestion pills. You could buy that over the counter. Great. I came walking right in this door again, you know, with a big smile on my face, knowing. But yeah, there's different medications, different forms that people have to take. But that doesn't mean that you have to stop them just because you're feeling great with what's going on here. And then you say, well, I'm going to stop the medication, you know, because that's not a good idea. You know, you've got to listen to your body. You've got to listen to what the doctor says. And I know you guys, as far as practitioners and so on, and I've learned this by listening to you guys, you're not supposed to give any medical advice, and I can understand that. But I think as a, what am I called when I, oh, okay, that. I think if I lie, and if I tell you guys, I'm on a new medication, I need to do this has happened to me, and so on. To me, that's important. I need to tell you guys that. You know, and that's the important part. You can't give me a medical information, but I can definitely give you. And that's the encouragement that I give for somebody laying on that table, to open up and say, and don't be afraid of it, and don't be shy about it, you know, and that they should, because that will help you guys to understand. Because I'll use Paul for an example. He can work me and work me and work me, and then all of a sudden he's on the spot, and it goes on and on and on, and it's the spot that I'm hurting. How in the heck does he know that? You know, how in the heck does he know that?
You probably light up like a Christmas tree.
He did. His hands were hot. His hands were hot. That's a healing to me. That's a lot better than taking a pill over the counter or a pill from even the doctor. And I'll talk to the doctor about it, and I'll say, can I go off of this medication? Because I feel I'm getting a little bit better. I'm going to BioTouch. And they, well, what's BioTouch? And so before you know it, the word is spread, you know? Mm-hmm. But it's true. Medication, you've got to listen to the doctor. You've got to take what is, because everybody is different. But there's no sense of holding it back and not sharing it with you guys, because I think it's important.
Perfect. Mm-hmm. Thanks, Donna.
Okay.